All right, we're recording. All right, folks, we're back again. It's Wednesday night, 7 p.m. We are back again for the Resilient Body Workshop Series. Tonight, we're going to go over the neck. We are going up the chain here to the neck. We've got a class going on, and hope you guys can hear me. So just like I do every week, if you could see me and hear me well, just give a little yes or thumbs up in the chat room so I know that you guys are reading me loud and clear. We'll get started. Awesome. Thank you so much, Karen. All right, so today, this workshop is for you if you have neck pain, stiffness, discomfort, you're stuck at home like everybody else working from home, you have numbness or tingling in your arm, or you don't have any neck issues and you want to keep it that way. All right? Just like every week, we're going to learn some things. And the things that you're going to learn tonight are the connection between your neck and headaches, the truth about perfect posture, and three simple stretches to reduce or abolish any neck pain. All right? What's in it for you? You're going to reduce your stress, stay pain-free and productive, right? Because nobody wants pain. That creates stress. It's a big cycle. Pain gives you stress. Stress gives you more pain. You want to break that cycle, improve your posture, and everyone wants to eliminate pain. Nobody wants to live with pain. So we're going to do that too tonight. All right, so every week I always give this disclaimer that this is our Resilient Body Workshop Series. It is designed to target a broad audience. You know, we're going to be recording this for people who have missed out on this. So please, if you're going to chat, you know, don't reveal any private info or stuff like that. I've made up these webinars based on information and advice that I've given to my clients and my patients over 20 years of my practice. You know, it's good general advice for a broad audience, but it's not going to work for everybody. So contact me personally if you're dealing with a specific issue. If you're having pain, you know, don't try and, you know, live through it. I give free consultations, you know, 30 minutes a session. You come in, we talk about it. We have a deeper conversation about what might be bothering you, you know, how I could fix it, if I could fix it. And that way you can figure out if you'd be a good fit. You know, I post a lot of videos online on my YouTube channels and everything. And again, those are general tips. And I never want anyone to take away, especially tonight, that this one tip or one exercise is going to be the complete answer. You know, the only way to get better if you're dealing with something is to get a full customized assessment and treatment plan so you can get to the root cause of your problem. Okay? All right. So today also, if you're going to stay to the end, I'm going to give out a special product giveaway at the end to address neck stiffness. Last week, I didn't do it live because I didn't actually have the product with me. It's still being shipped. But today, I got it right here. I'll give that to you. I'll give you a peek at the end. And also, we've got, let me just check the list here. We've got a couple people in the running for our grand prize Perfect Attendance Award. Perfect Attendance Award is going to be the Trigger Point MB Vibe vibrating massage ball. Someone at the end of the 6 weeks is going to get it. All right. So if you don't know who I am, my name is Dr. Paul Kachoa. I am the owner of Par 5 Physical Therapy. I'm in Randolph. And again, like I said before, I've been a physical therapist for over 20 years. My goal is to help active adults get back to doing the things that they love to do without pain meds, injections, or surgery, even if you've tried physical therapy before. All right. So let's get into this. Now, again, we're going to go over some stuff, some exercises, some drills. Remember, let pain be your guide. Do not push through the pain. Go slow. All right. And we're going to try, and especially because it's the neck, it's easy to do. You don't have to set aside time to do these things that we're going to discuss tonight. Try and do it when you're working. Definitely. We're going to talk about posture as well. All right. So here's our quick review of our joint by joint approach. The body functions on this alternating pattern of stability and mobility. Okay. If this pattern is disrupted, then pain or injury is the result. So this pattern, joint is stable, mobile, stable, mobile, stable, mobile. Now, when it comes to the neck, it's a very complex area. It's very mobile. We can move our neck all over the place. So we got to take a closer look. We actually divide the neck into two parts. We have the lower region, or lower cervical, and upper cervical. So the lower cervical is stable, and the upper cervical is mobile. All right. So just like every week, we're going to do a pretest. We're going to look at how you are moving, and then see if we do things in the workshop today to see if we can improve our mobility, and then do our post-test. I always do this, especially with visits in the clinic. You know, I always do a test, some type of treatment, and then test again. Because if there isn't any changes from the pre or post-test, then what did we do? The treatment needs to be effective, and we need to show that it's effective. So these are the tests that we're going to do: flexion, extension, and rotation. Complex words, but we're going to go over it one by one. Flexion is the first one, cervical flexion. What you're going to do is basically, with the jaw closed, you're going to try and bring your chin as far down as you can into your chest. Now, you should be able to touch your chin to your sternum, the top part of your, where your clavicles meet, right on your chest there. If we cannot get through that, if you're missing that range of motion, or there's pain, there's some dysfunction that we have to unpack. All right, we'll work on this a little bit today. Cervical extension is basically the opposite direction. With the jaw closed, you're going to be looking up, shoulders should stay relaxed, and you should get your face close to parallel, like what you see in the picture there, at least 10 degrees away from parallel. All right, if we don't get that, if we get some pain, then we'll have to unpack that and look at that as well. The next one, rotation, cervical rotation. What's our landmark here? It's our collarbone. Shoulders stay relaxed. You should be able to bring your chin to a point that covers the mid collarbone. And you should check that bilaterally. A lot of times people try and rotate, and they'll try and cheat with their shoulder. You got to watch out for that. Another one that's not pictured through here, and I do a lot with my clients to make sure that they have full neck range of motion, is the chin to collarbone. Okay, so again, jaw closed. It's kind of combining the two motions, flexion and rotation. It's bringing the chin to the collarbone. If you can bring your chin to your collarbone without hiking up the shoulder, then we're good. You pass. If there's space, then we got to work on that. You're tight. And that's very, very common. That kind of comes out of a muscle in the back that we're going to use something on later. Mine is tight too. All right, next one. Headaches. Let's talk about headaches. So there are many different types of headaches and many different causes of headaches. What particularly I like to work on or touch on today is called a cervicogenic headache. And that's when there's a trigger point or a joint problem, a facet problem in the neck that causes pain. So the next picture are the trigger points in muscles that connect the head and the neck. And the X's on these pictures are the trigger points, and the red parts are basically where those trigger points can refer to. And like I said before, it could also be a positional fault in the cervical spine, in the vertebrae, that could also cause these headaches too. Muscles causing pain that are referred to the head. All right, so perfect posture. So the truth about perfect posture is that there is no perfect posture. There's no such thing. While there is an ideal posture which can balance the weight of the body and distributes the forces over the soft tissue and bone equally, there is no perfect posture. Your perfect posture is a neck posture. Our bodies were designed for motion. We weren't designed to sit statically. We have things like fascia, connective tissue. Our body is like 80 to 90% made of water. We need to hydrate, and we need a pump to facilitate fluid transfer and circulation. Movement helps us do that. And if we don't move, if we don't stretch and move, then the tissues can become dehydrated, they can be stuck, they can become sticky, the fascia, and then you lose mobility. So ergonomics, let's touch on ergonomics. Everybody's working from home tonight, right? Or today. And, we know that sitting is not good, right? It decreases circulation. It inhibits key muscles that we need to hold ourselves up and move through our world. So I like to use something as like a little guide as 30 minutes. You should not be sitting or standing for that amount of time. 30 minutes for sitting, and I think, yes, 60 minutes for standing. All right, so it's a sitting desk, standing desk, it doesn't matter. There's always a limit. It's either going to be you're going to fatigue, or you just need to move because your body needs to move, basically. So here are some guidelines. We want to avoid lazy sitting, kind of like slouching or whatever. We want to engage our core when we sit. And when we stand, we want to avoid the arch, kind of like being hyperextended through the lower back. So for both positions, sitting or standing, I like to think about it as pulling your belly button into your spine, activating the core at least to stabilize your trunk and allow to kind of unload your back and your joints. So that way your neck, shoulders, and your arms can do what they need to do off of a stable base. All right, so move a lot and move often. If you follow me on Instagram, this is one picture that I brought up today, is what does a sleeping baby have to do with the resilient body workshop, the neck in particular. So sleeping is the time that allows our body and our brain to recover from the stress and the work of what happened during the day. So we want to be able to recover in a position that is the most neutral as we can get to provide a good position for our tissue to relax and recuperate. So if you are a stomach sleeper, that's probably the worst thing that you can do for your neck or your shoulders. One, it's good for children, infants, because they need that tummy time to develop those curves in their spine. But for adults, you have to turn your head. And if you're going to be turning your head for a prolonged amount of time, that's going to cause one short side and one long side. And that imbalance could lead to a lot of the stiffness, pain, and injury that you have in your neck. So unless you have a bed with a cutout for your face to stay in like this, to stay neutral, I wouldn't advise sleeping on your stomach. Sleeping on your side is a good alternative, or sleeping on your back would be the best. All right, so let's look at the 3 simple stretches here. First, we want to be able to stretch tissue, stretch muscle, and keep them elongated, keep them supple. The brain is the key thing. A muscle will only relax if the brain allows it. So when we're doing these stretches, we want to focus on relaxing. And one way to do that is to concentrate on our breathing, the way that we breathe. Belly breathing, not chest breathing. And also making an exhalation that's twice as long as our inhalation. Okay? So I like going in and out through the nose. But definitely the key point here is to exhale twice as long. All right, so let's get into the stretches here. So this is one that I like to do often, because if we sit a lot or have everything below us, we're always going to be looking down, and that causes a rounding of our mid-back, the thoracic spine. And if we look at that picture that we had before, the thoracic spine needs to be mobile so that the lower neck can be stable and the upper neck can be mobile as well. So using a foam roller, we're going to kind of go segment by segment, engaging the core, trying to stabilize the lower half of the body, keeping your feet and hips still. You just take that upper half and kind of extending backwards. And we do that segment by segment. Thoracic extension will solve a lot of shoulder or neck issues. And you can also do this seated. If you have a chair, this chair that's pictured there isn't the best, but one with 4 legs and that's sturdy, and then it has a back that might be just at mid-back height. You put your feet on the floor and then hands across your chest, and then you're going to do that same type of extension. The big thing here is, again, to keep the core engaged, so that you don't get that motion that you're supposed to get at the thoracic spine at your lumbar spine. You're hyperextending. All right. So this is a chin tuck with an extension. One of the first things I tell patients to do if they do have neck pain is see how do they feel when they do a chin tuck. And a chin tuck is basically that first move when we bring your chin straight back. The extension is when you look up. So a lot of times we get the issue with the back tissue of the neck and head being tight because of that forward head. For every degree, there is this curve of increased weight on the soft tissue here. So if I'm here and I'm looking down at 60 degrees of angle of my neck, that kind of relatively puts 60 pounds of pressure on the soft tissue back here. So we want to try and stay tall and not have our chin be jutting forward. So the chin tuck is basically trying to keep that chin level and then bringing it straight back and seeing if we can do that and reverse that forward head position. The chin tuck with extension is trying to maintain this position and then bringing the chin straight back into that full range of motion. So those are things that you could try and do to, one, get you out of a bad position, get you out of a bad posture position, and also improve the mobility of your neck. So for headaches, or for people who have headaches, the suboccipital release I find is very, very helpful. Just take like a ball, 2 lacrosse balls that are taped together, look like a peanut, and you put it at the base of your head. You might have to hold it to stabilize it a bit there, but then once you kind of relax, you have that pressure right at the base of your head, and you could do a little bit of nodding or a little bit of turning to help reduce that tension on that tissue as it inserts at that base. So you can kind of feel, if you feel back there, the big bump in the back of your head, that is just above where that cervical spine begins. So if you start there and you put the ball right below that bump and lie down on top of it, that's where you can release a lot of that tissue that inserts onto your neck at that area or the base of the head. All right, so once we do that, now let's just review the thoracic extension over the phone roll. If you're doing some type of joint motion or joint mobility exercise, I always advise people to try and do it for at least 2 minutes. It should take you at least 2 minutes to get through the thoracic spine at all those different levels. The chin tuck, it's an active motion. We're not really necessarily holding any end range or position unless you want to really, get a little bit of self-mobilization at the end. But I think that a chin tuck and an extension is sufficient. You don't have to do that shake. And I would try at least 10 of those, just constantly going through that. Every half an hour, if you are suffering from neck pain or if your neck feels stiff, the more often you do it, the more you'll be aware of your posture. And the suboccipital release, you can do that once a day and also for 2 minutes. All right, so after we do all that, you're going to try and check and see what the motion is like. So we're going to do our, chin to chest, see if that's looser. We're going to look at that extension after we do a couple of those chin tucks with extension. And then rotation, okay? So hopefully, if you're keeping up with me or doing these things at home, your neck should feel a lot looser after you get done. All right, but if you are dealing with any neck pain or soreness, you can go to this website, my website here, par5pt.com/neck pain treatment, and you can get this free ebook, Keys to Healing Neck Pain. So something that I wrote, I think, last year to kind of, distribute more information to more people if they do have neck pain. So you can check that out. And then, or you can schedule a discovery session. So again, if you're already in pain, I already mentioned this free consultation earlier. It's 30 minutes long. It's not a full evaluation, but it's not a creation of a full treatment plan, but it's a conversation, having a conversation about your pain, your symptoms. And at the end, you can make an informed decision whether or not Par 5 PT would be a good fit for you, right? And if so, you can set up an appointment from there. All right, so here's a recap of what we learned today. All right, 7:21. I knew we can try and get things short, concise, and get things under 30 minutes. So we touched on headaches. The trigger point is where you're going to kind of push on and use that ball to release those suboccipital and maybe neck trigger points that might be contributing to your pain in your head. Talk about perfect posture. Movement is probably the best thing. Your perfect posture is your next posture. Thoracic extension, we want to be able to move through that thoracic spine, extend through where the rib cage is attaches in your back, so that the load isn't going on your back or your neck only. The chin tuck, get rid of that forward head position, push it back, mobilizing the neck. Try and stay balanced over your shoulders. Get rid of that text neck and that suboccipital release with the ball. All right, so again, I touched on this before. If you're going to be coming again each session, I take attendance, and then at the end we're gonna raffle off this vibrating massager. But for those of you who are here tonight, we're going to give away the Rock Balls Infinity. All right, so I'm going to put up a list here, and these are two balls that are fused together, just like that peanut where you tape the two lacrosse balls together. So I'm going to give it out to one of you guys. I got the list here. And 7. So I'm going to hit the random number generator. If you could see this, it's at 0 right now. And we're going to pick a number between 1 and 7. All righty. And I'm going to look down my list. Who is number 7? Here we go. Randomize, randomize, randomize. What number does it say? 6. And the winner is, let me count down. 1, 2, 3, 4, 5, 6. SK. SK is the winner. That's your initials. 1, 2, 3, 4, 5, 6. Not 4. Sorry. I think, Aaron, I think your order might be different than mine, but unfortunately, I will see this person tomorrow night. Congratulations. You won the Infinity Balls. Here they are, right here. Shiny. Actually, not shiny, but rubber. So I'll be touching base with you tomorrow. All right. And then, again, let's just review, wrap things up. Workshop series goals. No more aches and pains, right, for the 6 weeks. Build a resilient body. No more stiffness. Avoid injury. Enjoy your time with your family and friends. Don't be in pain. Be more resilient and confident. All right. 724. Excellent. All right. So I'm going to be here if you have any questions. And again, thank you folks for staying in with me at 7 p.m. for half an hour for the Resilient Body Workshop Series. We went over the neck today. If you want to schedule something with me, you can put it in the chat or stay afterwards. Otherwise, next week, we will be going over the hip next week. Another body part that needs to be as mobile and as strong as it can be. Thanks for hanging out with me tonight.